In order to really be able to start to plan mental health services, you really need to know where they are and what they do. And MChart brings together different information to make it easier for planners to plan mental health services and for navigators to find services for the people they're caring for.
The health system is not just the public system, it's not just the hospital. So it involves the NGO sector and primary care and the private sector. So this tool actually lists across those different parts of the system what services actually exist in Canberra. And that's useful for us as a planner to know about, particularly if it's not government funded, because they're not visible.
As a commissioning organisation, we draw on a lot of data sources to develop our needs assessment, which provides us an opportunity to identify any gaps and service needs. And so we see the MChart being able to provide us with that data that we need to be able to prioritise where those service gaps sit and where those needs might lie.
One of the biggest things working in the sector is navigation. An organisation such as ICLA, you're constantly trying to find information that's up to date, accurate and easy to understand. So timing is of the essence, particularly when we talk about people in crisis or people who have urgent needs. And so having a tool like this that can easily translate information, quite a lot of information, visually and easily accessible is quite a good way forward.
We were very delighted to be able to support MChart. MChart's ability to map service supply and demand and overlay this with socio-economic data and test what-if scenarios is a very powerful planning tool.
At a navigation level, it's more a matter of, say, I'm a mental health service provider and I'm trying to think about the services which might be available for the person I'm seeing. And MChart will show me what services are near where the person lives. It'll show me when they're open. It'll show me who works there. And again, that helps all build an understanding of the context for building a care plan for an individual. So you've got a system level and you've got an individual navigation level.
I like the connectivity component of it, so that just lists what services are connected to what and how well they're connected. So that gives you a good overview of where there might be gaps in referral pathways for people accessing the system and who might be useful to engage with.
What is great about the MChart is the ability to access service, which helps us really in that planning phase in determining for a user of these health services those important factors such as transport and accessibility. So I think the ability for the MChart to have been flexible enough to be able to have incorporated those elements has been really important.
One of the biggest attractions of this tool is a lot of great points that could be utilised potentially for a lot of government departments to fund and provide grants and tenders to obviously map out services. Now, if we're going for a tender, last thing we want to do is to duplicate services in an area that's already got a lot of services. So having visibility on these type of things also allows us to provide services in areas that there are gaps.
It's also informed by an expert panel process, and the expert panel has been made up of end users, including psychologists, psychiatrists, the partner organisations, consumer advocates, and we've been really appreciative of the time and efforts that the expert panel have contributed, and it has actually changed the tool and made it a better tool.
The collaboration with the University of Canberra demonstrated how universities can act as test beds for applied innovation that then translates into practical tools and solutions.
When people work together in a region, they can surmount barriers that have traditionally kept people apart and made tasks difficult. It's a really good template that I'd love to see applied in housing or in employment or in disability services or lots of other areas of the way we plan regionally.